Okay, so I'm going to present our work about treatment effectiveness of the preschool-based ESDM intervention in ASD preschools in Israel. So all of us who deal with early intervention know that CMIs have been shown to improve core social communication difficulties that characterize children with ASD, and the ESDM is such an intervention that was shown to be effective in home and center-based programs, as well as group-based settings and preschool settings. But there is no research so far on the effectiveness of the ESDM integration into existing community services. All the early intervention studies already conducted were conducted in the lab or at homes or in preschools that were developed for research purposes, but not in existing community services. And in Israel, the educational system is the main provider of early intervention services for children on the spectrum, and this is why it was of high importance to integrate evidence-based programs into those settings. People nod, so I'm really happy that you agree with me. And the other part is the parents. The children with ASD have a key role in mediating the interventions that their kids receive and supporting the generalization of skills. However, school-based ESDM studies did not include yet parent coaching component, and we wanted to check it as well, to evaluate it as well. So the study had three main aims. The first one was to examine the effectiveness of a preschool-based ESDM program conducted in community ASD preschools involving parents as agents of change, to compare the effectiveness of the PBESDM program to that of existing developmental integrative intervention programs, which are commonly applied in community ASD preschools here in Israel, and to examine the effect of the PBESDM model on child communication and parent-child synchrony during parent-child interactions. So we had 8 ASD community preschools with 8 to 9 children each, selected from the preschools jointly operated by the Israeli Ministry of Education and the Autism Treatment and Research Center at the Association for Children at Risk. 4 preschools were selected to employ the PBESDM, and 4 served as controls implementing the commonly used DI program. And the groups were comparable on background, cognitive, and adaptive measures, pre-intervention, and this is the baseline measures, the comparison between the groups, as you can see. The programs were identical in the number of educational hours and therapy hours that the children received per week, and in the composition of all the different professionals, the educational staff, and the intervention, the therapeutic staff. But they differed in staff supervision method, in goal setting, and parent coaching. So those are the differences, as you can see, in the way supervision was provided in the 2 groups, the intervention goal setting process, and the parent coaching that was only part of the PBESDM, while the DI group received fortnightly parent consultations or parent training sessions. So in order to integrate an existing intervention into our preschools, the ESDM basic and advanced training was administered to 5 therapists who completed the whole certification process. It was very long and complicated. The ESDM training materials were translated to Hebrew, and we conducted one-day workshops in the preschools for the whole preschool staff, the educational and the therapy staff. The assessment tools included the Mullen, which is a developmental tool, the Vineland adaptive behavior scales, a behavioral microanalysis of parent-child play interactions that we videotape pre and post the intervention, the long year intervention, and parental fidelity of ESDM implementation. And these are the main the results. So as you can see, the main outcomes when it comes to developmental improvements. So there were both groups significantly improved in their expressive language skills, but only the ESDM group, the PB-ESDM group, significantly improved in the receptive language skills. Both groups significantly improved in the motor age equivalence and the total age equivalence, but as you can see, the PB-ESDM group improvements were better. They gained higher scores. In the violent parent reports, it was interesting to find that parents reported on significant improvements only in the PB-ESDM group, in communication domain, in the socialization domain, and in the domestic skills subscale. And the teachers reported on significant improvements only in the PB-ESDM group, in the communication domain, in the daily living skills domain, and in the coping skills subscale. The second part.
Sorry, can you explain a little bit about the model, what you actually do?
In terms of, can I?
The ESDM model.
Okay, that's really tricky. We're going to have actually a one-day conference on the ESDM at the end of this month. So everyone who's interested will be able to attend it and learn more about at the end of March. It is an NDBI that integrates developmental techniques with behavioral techniques, and again finds or focuses not only on one-on-one or group interventions, but also on working with the parents. Where was I? Okay, so in terms of the second part was the parents and the children and the interactions between them, because the parents attended weekly parent-child therapy sessions in the preschools. So it was interesting to find no significant changes in parent ESDM fidelity scores between the two measurements. We think that there might be a possible seeding effect. However, increases in the following, and I'll explain, following parental interaction skills that the parents actually acquire during the the parent coaching piece of the intervention positively and significantly correlated with behavioral gains in child communication. So as you can see here, it was really interesting to find that improvement, that parents who improved in their attention management skills, it was actually correlated with child gesture use and child gaze to parents. So those more, yeah, with improved child gesture use, with improved child gaze to parent. The same thing with behavior management that the parent actually did with the child, and use of teaching strategies that they did with their child that were correlated with improved child gesture use and gaze to parents. And we also find that correlations between improved communication opportunities, which is a parental skill, with improved child gesture use and activity structure, which is another way to say promoting play strategies, was also correlated with child gesture use. And this is another cool thing that we found. So we found behavioral parent-child positive affect synchrony, which was really, really nice. And we found it only in the PBE-SDM group. So during the interactions, parents and children were synchronized in their positive affect.
With an increase in it.
An increase, yeah. And this is. Okay, so she's providing choice. She's focusing on positive affect, on playfulness, on managing his attention, on keeping him motivated. Elaborating the play.
She's the mother?
Yeah. And here's another mom. These are 3-year-olds, okay? Now she's trying to elaborate. Okay. We have so many videos. So the conclusions from, based on our findings, were that the ESDM can be integrated into community preschools with developmental and adaptive outcomes that we have shown to exceed those found in community preschools implementing the developmental integration intervention, and that parental involvement in the PBE-SDM intervention improved child-parent positive affect synchrony, as well as, the parents, the parental different skills, of course. An improvement in parental interaction skills in the ESDM group was related to improvement in child's communication use. And that was, I think, the most important thing, that integration of ESDM into community ASD preschools is both feasible and effective. So in terms of clinical implications and future research, we hope to conduct future RCTs with larger sample sizes to examine the active treatment ingredients, meaning what works, what exactly in the intervention works, and treatment response predictions, meaning what works for whom, and also to compare ESDM to other evidence-based practices. I would like to express our gratitude to the participating families, the preschool staffs, and the Israeli Ministries of Health and Education for the contribution to the current study. The implementation of this program was supported by the Harry and Janet Weinberg Foundation, and Yana, the doctoral student who was supposed to be here with me and couldn't, was supported by Bar-Ilan University. Thank you.